Hi, good evening. My name is Desiree David, and I'll be going over my educational plan on asthma. So, what are my clear objectives that I want my students to know by the end of this plan? Number one, identify the normal physiology of lungs versus the pathophysiology of asthma. Number two, demonstrate proper assessment of asthma. And number three, understand the asthma medication and know how to use them. Now, what is my content and my process? I want to use a lecture setting to present all the information and facts of asthma and medication. I want to do a pre-assessment evaluation on my students before I begin. I want to know how much do they know. Have they ever suffered with asthma? Do they know someone who has? I want to know how much they know before we begin. Now, I want to present that asthma is characterized as a spastic contraction of the smooth muscle in the bronchioles, causing extreme difficulty breathing. Asthma is an allergic hypersensitivity to certain objects such as dust, pollen. It can be animals such as cats and dogs. It can be medications such as aspirin and NSAIDs. And as well, upper respiratory tract infections can aggravate and bring along asthma and asthma attack. Now, with medications, it is important to lecture albuterol. Albuterol comes from the adrenergic agonist drug class. Its action is to stimulate beta 2 adrenergic receptors in smooth muscle of the bronchi to produce bronchodilation, causing an ease to breathe. Now, some side effects are muscle tremors, excessive cardiac and central nervous system stimulation such as angina, chest pain, tachycardia, palpitations, anxiety, insomnia, and seizures. There's a black box warning for this medication that salmeterol with significantly worsening deteriorating asthma may be life-threatening, and this drug class is used to prevent bronchospasms in people with asthma and other reversible obstructive airway diseases. Now, this class is very good, but I want to do another class to teach them anticholinergic group drug class. A medication is called ipratropium. It blocks acetylcholine receptors in smooth muscle of bronchi. It inhibits the bronchoconstriction and mucus secretion. Side effects for this medication are cough, nervousness, nausea, GI upset, headache, and dizziness. This drug class is contraindicated for those who suffer with narrow angle glaucoma, BPH, bladder neck obstruction. Now, with medication, it is very important that my students know the difference between short-term therapy and long-term therapy as well. With an acute asthma exacerbation, it is important to use short-acting beta-2 agonist medication for quick relief of asthma symptoms versus long-acting such as salmeterol from the anticholinergic group as a maintenance therapy. The short-acting and long-acting have adverse effects of tachycardia, hyperglycemia, low potassium, low magnesium, and muscle tremors because it's trying to dilate the lungs to bring relief from breathing. Once my students have solidified and learned this education, I want them to next move on to a simulation lab. A simulation lab will help give them a real life scenario of an asthma attack. I'm gonna have my students separate to roles such as the primary nurse, secondary nurse, a medication nurse, and a communicator or a recorder. Real life situations of asthma attack is very different from learning in a textbook. The simulation lab, I'm going to run a scenario where the patient's having asthma attack. My students are going to think quick on medications to use and what to bring during an asthma attack such as that. And I think that would be very helpful. And in order to evaluate them, we'll have a post-session post simulation lab to discuss what did they learn, what could they have done better, what could they have taught the patient better, and how to properly assess. Auscultation of the lungs are very important as well, to hear the wheezing. Is a perfect assessment that'll tackle one of my objectives, which is to demonstrate proper assessment. Lastly, to understand the asthma medication, know how to use them. Just from my experience, I want my students to know what inhalers look like. Inhalers come in different shapes, different sizes, and it's important to teach your patients who have asthma how to use them properly. I'm hoping that my academic place of where I'll be teaching asthma will supply certain examples of inhalers or round ones, and how to teach the patients how to use them. After all this is done, with the teaching what asthma is, the medication groups, the differences in between them, and a proper simulations to scenario of how to treat asthma, I will debrief and do a Jeopardy. I would like to do a Jeopardy PowerPoint to, I want to say, to help them learn asthma and medications quicker and have fun with it. Jeopardy brings a group effort, the class and group discussion, that'll help learn asthma and respiratory medications, which are pretty hard to understand and grasp. And lastly, a test will be given. With the test, I'll have questions such as, a patient asks, what are the side effects of using albuterol inhaler? And that answer for that question will be all of the above: muscle tremors, tachycardia, anxiety, and insomnia. And also some true and false questions. One example would be, those who have asthma are recommended to take only corticosteroids in as a maintenance or stabilizing treatment. The answer is false. Short-acting and long-acting medications are the main medications to help asthma. Corticosteroids are short-term, and they help with specifically inflammation. What questions do I expect my students to ask? I think my students will be asking my experiences with asthma. Patients, I will let them know, unfortunately, because we have respiratory therapists, the nurses don't involve themselves much with respiratory medications or respiratory diseases with patients in the hospitals. And that's why it's important to brush up and learn how to use the medication to teach the patient, because sometimes you can't always call the respiratory therapist for help. You have to know it yourself and teach your patient the correct maintenance therapy on how to prevent and maintain their asthma, and to prevent asthma attacks the best way they can. Well, thank you, and that's my presentation.